What would be the correct ethical way for the consultant? What should the consultant do?
It means the patient's right to decide what treatment, what has to be done, and also has the privacy and confidentiality.
Should the patients be told that AI is involved in their care? Do hospitals tell, or they're supposed to tell?
I went recently to a dermatologist. I had to sign a consent that AI will be assessment.
As of today, do you as a patient trust AI?
What part of AI is going to be used for your assessment and for your treatment?
Where is the world now? Are we at 3 out of 10? Are we at 7 out of 10? Because that will decide how much we have to work more.
It'll be difficult to say that the global, because each part of the world will be different, depending on the government, depending on the company.
This ethics and morals, can they be taught or they are inbuilt in family values?
We're teaching it for you to develop ethical competencies. But no teaching is complete without an assessment.
Good morning, everybody. I am Dr. Rajiv Ahluwalia. I am the Dean Student Welfare at the Santosh Deemed to be University. And I am also the head of the National Bioethics, Dental Bioethics Unit, UNESCO Chair in Bioethics, Haifa, in India. So today we are very pleased, and in fact, I feel honored to have with me Professor Dr. Russell D'Souza. If I go into his introduction, the whole podcast is going to finish in that. So probably I'll just, and actually he needs no introduction, but still for some of our viewers, Dr. Russell D'Souza is the head for the Global Chair in Bioethics, Medical and Health Professions, Education. He's from Melbourne, Australia. So, sir, welcome to this podcast. As you know, our university started this podcast last year, and primarily it's a student-driven podcast. And today also, while I'm interacting with you, the preparation by the students has been going on for a long time, and there are some, you can say, dilemmas or questions they have, which I am taking the responsibility of, taking a feedback from you on that. So what students wanted was that, sir, please focus on clinical scenarios, practicalities, the theoretical aspect, most of them already know in our university. So allow me to focus on the first question, sir. Do ethical dilemmas arise more from systemic failures or individual decision making? If you allow me to give an example, you know, uh, suppose there is a senior consultant and he evaluates a 45-year-old woman who has acute coronary syndrome. Now, the results show that she requires urgent angioplasty. The procedure, say, may cost 3.5 lakh rupees in India, but the patient has only partial insurance covering only 1.5 lakh rupees. So the patient financially is 2 lakh rupees short. The procedure requires urgency, but the family cannot immediately arrange the money. So this is kind of a typical scenario which we face day to day. And the hospital policy states non-emergency invasive procedure require financial clearance before initiation. The cath lab in the hospital is available, and of course, as we know, as medical people, the delay may cause irreversible myocardial damage. So now, should we proceed immediately? Should we wait for the financial clearance? Clearly, there is a bioethical issue here. Could you comment on this kind of a real scenario?
Thank you very much, Rajiv. This is you're absolutely right. This is particularly in this part of the world. These are day to day. In fact, the same thing will be something that happens in countries like United States, where they don't have a universal health. I'm from, incidentally, the global chair, which is, of course, the UNESCO splitting into the international chair and the global chair. And it's based in Melbourne, Australia, where, of course, we have a different systemic system because it's we have universal health. Now, there this doesn't arise. Where in that type of situation, Uh, Emergencies have to be done. That's the agreement with the citizen of the country and the government. So it's covered by the taxpayer, which is called the universal health care. Now, if it's not urgent, then comes the next issue in that situation where you are triaged into a waiting time. Okay? And that sometimes is again a question that one can ask in terms of from an ethical perspective. But when you look at this scenario that you've just presented, it comes, which is very common, particularly in the places where we don't have universal health care. Now, one must bring in here, this is a dilemma. You have a systemic government, or at least an institutional rule. On the other side, you have compassion and also not only empathy, but fear of damage and irreversible damage. So I think putting these things together, one needs to be able to look at their ability to have uh, what you call uh, 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 in the systemic rules, they should be able to caveats that would cater for situations like this, where someone, as you mentioned, haven't got the ability to immediately collect or get these funds, but maybe they will get it later. So we should be able to make that amount of judgment or make allowance that life is important, irreversible damage cannot happen. And so whatever funds they have, and the rest would need to be on a discussion on what are the options available. There may be a number of options that your institution can help to augment these type of situations. Thereby, we are fulfilling the ethical requirements, the scientific requirements, the moral requirements to look at life and the importance of human life, human dignity, and so forth.
So, sir, now since the normal public is going to be viewing this, the students are watching this. I feel the question little bit remains still unanswered. On one part, the doctor feels this needs to be done. On the second part, we cannot force private self-finance hospital to forego the financials.
I
It's
think
a
that's why we need to be able to look at. I mean, the institution has also got a legal and ethical requirement to make it viable, and so that's one part. And the other side, we do have the patient's inability on one side to get the funds, but on the other side, the frailty and the fragility and the challenge to life itself. And this is the two balancing that we need to come out with. And I think the while all dilemmas generally do not have a perfect yes, right or wrong, we always want to achieve the best possible situation or outcome at that time. And so I would think that there must be discussions on a systemic base where the institution might have to consider different alternatives to collect that funds, or for that matter, in situations like this. On the other side, we must have the enough knowledge because they have to make an informed consent, and that information should be enough, or should be covering the requirements for them to be able to make an informed decision as to the need to have this procedure, its relevance, its importance, and ultimately finding their way of how they're going to solve this. So, if time is the matter, then the institution takes this into account. saves the life, saves the heart, and gives them option to pay this money in due course. It's difficult because, as we both know, both need, the life is one side, and the institution needs to keep its financial status. If not, they can't serve other people. So we have, and that's how dilemmas are. It's always the challenge in us coming to make a decision that fulfills, or not only the ethical, moral, but there's also legal requirements here. No? Yes.
So all need to be looked into. It's a dynamic thing.
It's a dynamic, and I think covering all this, the legal aspect, because there is a contract, there is a requirement, there is, are they going to pay it? What will be how are they going to pay? That part is also to be considered. But all this with one important aspect here, the dignity and the value to human life is always kept in mind.
And the second is, which is in vogue, you give clear aligners. Now the conventional treatment is effective, as we all know, and is also affordable. The aligners is works, but definitely is more expensive. So now the senior consultant is conveying to the junior doctor that you don't give option one. You give aligners is the solution for you. And of course, since the patient is adult, is preferring aesthetics and, the clinical benefit also. This, if I don't want to bite the words, but this is also a, everyday situation. So the young dentist is hesitant after hearing this, and conveys to the patient. A patient also hears the cost for the aligners and, is a little bit taken aback. So what is the option? What is your suggestion for this young dentist, that how should he take, how can he develop ethical courage in a hierarchical system? At one, his job is important. On the other hand, he's been instructed like that where he's working. So how to deal with this situation?
Again, Dr. Rajiv, a very common dilemma faced by a young professional who wants to hold up, who has conscience and is very conscious about the ethical, moral requirements. And of course, this is a challenging area because he is working for an institution whose boss or supervisors are giving him information that he should transmit. He knows that it's not right. He knows that we are removing or not offering a possible solution that might be affordable and so forth. So in other words, the patient's informed consent to proceed is hampered because he's not given the full information. You're only giving him information that is suitable to you. So the young dental surgeon or dental practitioner is confronted with this, and I think what requires here is moral courage to be able to say, I don't agree, and I can't. This is very much from an ethical.
Do you think he will lose his job for that?
That's the issue, and again, this is where the question of what does moral sensitivity, moral courage, is to be able to first see this and be sensitized to the fact that there is something ethically not right here. Then having the courage to say, this is not what that to call out the wrong. And I think from this perspective, we have a challenging situation where he's likely to lose, he might lose favor with his boss, lose the job, maybe things like that. But the question again comes into how much will you accept to stand up for the right issue? For example, if you know that something is going to even take your life, lose the person's life. But so would you do that just because you're, a good example will come back to the Nuremberg code and the trial, where we saw the power and privilege of medicine being not people not having the moral courage to say what they were asked by the organization, by the country to do was wrong. And of course, we then see years later all of being convicted. So I think that type of that is an important aspect that we should, because if all are doing something wrong, it doesn't become right.
So how does the now young see the future is with the young healthcare professionals?
Yes.
So what is your message to them?
My message to all the young uh, medical and dental professionals or healthcare providers is that you should, uphold your ethical, moral um, framework that you have been trained. And you must also have the moral courage, not only in this case, but in every issue that you think patients are not going to be benefited or what you do might harm the patients. A good example will be if this patient cannot afford this treatment, they might go without it, not knowing that they have an option to correct this using the conventional method.
Also,
So always what you in part of the informed consent requires information on this issue, but also giving him the information that the other options might be available, are available. And if you didn't take this, what else can you do? If you didn't take both, what else? What will be the harmful effect, or what will be the not harmful, but what will be the result of this? And that is what informed means. Informed doesn't mean that you give only the information that you are wanting him to direct it. That is not the appropriate. So my question is, I think my advice will be to all young and future professionals, healthcare providers, that you need to give full informed consent. Even if your institution says this is all we do here, you might be able to tell them these are all available. If you don't take it, you can do this, you can do that, but they then leave it to them to make that decision. Would you agree with that, Dr.
yes, sir,
Rajan?
I think that's
You need to be able to tell. My institution doesn't do this conventional
yes.
theory, but that's available. The results are both going to give you, the end result is going to be similar. And this is what you do here, this is what you do there. And now, if you didn't take this, this is what will happen. And the alternate, and they make their decision.
Can we or should we have universal ethical standards, global ethical standards, or they have to be adapted to the local social and cultural context? All over the world there are some different social and cultural aspects. For example, let us take say Mr. Ramesh, who's a 60-year-old shop owner, and he's admitted in the hospital with abnormal pain and he's having weight loss. So now the investigations have happened. He's been diagnosed with advanced pancreatic cancer, which of course is a poor prognosis. Now the consultant has to meet the patient, but before that, the family of Mr. Ramesh requests a private discussion with the consultant, and they say that, doctor, please don't tell him that he has cancer. He's the only earning member of the family. If he knows, he will be, he will give up. And, you tell us everything, we will decide what to do, what to convey. Their concerns are, that it will give loss of hope to the patient. Elders, in some parts of the world, they believe they want to protect the family from bad news. Uh, in some aspects, the family takes the decision, not the individual. And of course, there is financial anxiety with uh, some forms of disease. So now what would be the correct ethical way forward in this for the consultant? What should the consultant do?
Now, this is a common issue that happens, particularly in a cultural setting. Now, I come from Australia, where we have a multicultural society, but the Australian laws and rules do not permit, they uphold autonomy. What does that mean? It means the patient's right, his or her first right to the knowledge and his right to decide what treatment, what has to be done, and also has the privilege of privacy and confidentiality. Right. If we did something like this, you would be breaching his autonomy, Ramesh's autonomy. We would be not only, and if we are sharing his details without his permission, is also not only unethical, but in the Australian context is illegal because there is a privacy law.
Okay.
So if you're going to tell them all his details, the blood test, the result, and the pathology, and so forth, he needs to give his consent for that. So that is one issue. Now we also have sometimes people like this from Chinese or Indian and others who have a cultural aspect of where they have shared autonomy, shared decision making,
Yes.
and this is now culturally appropriate in some situations. So the issue here is for you to be able to, the consultant to be able to make a decision based on which is the best way out here. For example, if the family is the greatest support to this Mr. Ramesh, without them, all treatment will not be successful. Then we need to keep that in mind. We need to keep in mind in some cultures, there is a belief that if they think this is going to make him die quickly, which also brings some cultures by the Chinese, they have, for example, the need to even be alive. It's called filial pity, where just being there gives blessings for the others, the rest of the family, even if it's only just being there. And so they would want to have this person as long as possible there, and the fear of telling him this will cut short this. So this is a cultural where you come from using this filial pity, their belief. But overall, I think the consultant needs to make a decision based on many factors, such as if I fell out with the family, will that benefit this patient? Because that is the support this patient has. And whatever direction of treatment we do we need to be able to have the family on your side, because that is going to be the one to manage this pay. So we will have to not ally them and say, no, I won't tell you, but we need to be able to talk to them, need to explain to them, because we need them also for this patient. And this way, ultimately come to maybe the decision, maybe the result being delayed a little bit, but ultimately bringing back into account the person's autonomy, but keeping in view that the patient, the family is also required. They are going to be the support, so we need to be able to bring them all together. And at the same time,
So yeah, if the consultant is a little bit more ethically trained, he will not only do the correct thing, he will also involve the people and get them on board.
yes, that's what you will do. But judging that this patient, the family is very important.
Yes.
So we cannot apply ethics and say autonomy. I will not tell you.
Yes.
Get his consent. We can't do that. We know that this is an important part of his well-being. So we need to temper.
As we all know, sir, you have been, traveling all over the world since the last 10, 15 years and giving back to the society. And, you've been working tirelessly, what I've seen personally, to create awareness in this aspect among the healthcare professionals and the public at large. So, so do we have a global ethical index? I mean, if I were to ask you, global ethical index out of 10, where do you rate? I mean, how many? What would you give the global ethical, if there's something like a global ethical index?
I haven't heard of the Global Ethical Index, but of course, we all know that there is a universal declaration on ethics and human rights that came up looking at some of the areas that you spoke. It takes into account, it's universal because it has to fulfill cultural, social, religious, all these factors that impact, and those 15 principles that the world came together on the 19th of October 2005 at the 33rd General Assembly of the United Nations brought these complex variables that impact on ethical and human rights and ethics, and then came out with this, and so named it the Universal Declaration on Bioethics and Human Rights, which actually takes into account all these other aspects of culture, religion, social, all these factors.
So, like, my question was, like, various organizations like the ICB and, individual bioethics units in universities and hospitals, uh, how much, path they have to cover. For that, we need a yardstick. Where is the world now? Are we at 3 out of 10? Are we at 7 out of 10? Because that will decide how much we have to work more.
Again, it'll be difficult to say that the global, because each part of the world will be different, depending on the government, depending on the company. Many of the
So, which part of the world is, would you say has a good, awareness, if I can use the
I
word?
think it's certainly, I come from Australia. There's certainly a lot more. Ethics is a very important part there. It's you have an ethical requirement. You've got hospital ethics committees, not the research, but you've got hospital even to decide the funding that the hospital needs to buy equipment. It goes through an hospital ethics committee who looks at what is the money that you're spending, who will benefit from it, access, will it be accessible, which comes under justice, right? So if we are doing if your hospital wants to invest in so much, who's going to be access? So this has to, the hospital committee, the finance passes it through the hospital ethics committee to give its approval to look from an ethical perspective, which includes access and so forth, which is justice, right? So there is a greater awareness, I think, and this is my subjective because I do not know about all countries, you see, but certainly I'm sure that in Australia it happens. I'm sure this must be the case in many of the more advanced or developed countries where they start to look at these areas. Yes, they have better finance, better all these areas, and but I think India has also got a very good high in certain aspects. They have ethical, moral consciousness or availability or it. So that's my belief here. But I don't think we have a global ethics index. Yeah. How would we put China, Russia? Because we know that,
like an average. I'm sure we don't even have a country-wise ethical index.
That's right. That's right.
So we can't have an average, but yes.
So again, when you talk of ethical index, what are we talking about? In which domain? You see, for example, I'm just giving you an example of an advanced country like United States, who would agree with some of the things that have happened. Would that be? It is not only forget about ethics; it is transgressing international law.
True. Hmm.
Then comes the ethics part of it, right? And something like that happens, and so it'll be difficult to put any. And if you have that might, there's even the ethical countries are keeping quiet. They don't want to say anything.
Yeah.
So all these things make us. It certainly brings one thing to the fore, that we need to think a lot more about ethics, moral values, alongside with the law and legal aspects. There's two aspects.
One more question, actually, one student asked, Sir, this ethics and morals, can they be taught or they are inbuilt in family values?
That's a very good question. Even when we teach ethics, one of the, we are looking, what do we teach it? We're teaching it for you to develop ethical competencies. Okay? But no teaching is complete without an assessment. If we are talking about teaching, there is a certain amount of ethical values, moral values that come from the family upbringing, from the culture, right? So there is a good reason for we have a school ethics program to bring this in. Okay. But when we talk about teaching ethics, we have one more component in assessing is the internalization. Your ethics, your teaching, this is right, this is wrong, this is right, this is wrong. And they are ticking off the boxes. But at one point, this becomes internalized.
Yes.
So they don't need a tick. They know it's wrong. They know it's right. So this is the teaching, but teaching must bring in internalization. And that we see over a period of time. And so in our assessment of ethical competencies in our students, we look at a longitudinal assessment where we are able to, what we call a formative assessment, that pictures evidence that ethical issues that you taught have now become internalized. In other words, it is first, without thinking, it will happen. When we are teaching them, they're going to be looking at, is this right? Is this wrong? Ticking out the boxes. But once it's internalized, it comes as natural. So we have a method of trying to evaluate internalization by looking at a formative assessment over 4 years. We have put instruments such as the scribe, which is systematic reflections over this period that the student keeps putting in, and we start seeing the evidence of from knowing what's right and taught what's right and wrong to actually coming internally that is right and wrong. So this is very interesting that you brought this up. Ultimately, we want it to be internalized. It is not a tick box. It should be internalized.